Okay, our next speaker is Professor Lian Zhang. He's the Secretary General of ISMIVS, International Society of Minimally Invasive Surgery and Virtual Surgery. And his topic will be pregnancy outcome of HIFU treatment for uterine fibroids and adenomyosis. I've known Professor Lian Zhang personally. I've met him many times. He actually came last year to, in fact, year before last, to give us a talk in the Obstetrics and Gynecology Society of Malaysia's Congress. Now, Professor Zhang Lian is a director of the Chongqing Haifu Hospital. It's a recent appointment. Congratulations, Dr. Professor. He's a chief editorial board member of the International Journal of Hyperthermia. He's a professor of the State Key Laboratory of Ultrasound Engineering in Medicine and a co-founder by the Ministry of Science and Technology and the Chongqing Medical University. He's also a professor at the Chongqing Medical University. He's received the first class in Science and Technology Progress Award of Chongqing in China in the year 2009, and second class in the National Science and Technology Progress Award of China in 2010. He has published numerous papers, 80 over papers in international and domestic journals, and more than 60 of them are SCI papers. And the highest impact factor is of a single paper is 16.95. And I quote many of his papers when I give talks, and it's a privilege to introduce and welcome Professor Zhang Lian to give his talk.
Thank you very much, Dr. Silva. It's my great honor to be here and have this chance to give this presentation. So first, I would like to, can you see my PPT?
Not yet, Prof.
Not yet.
Did you see it?
Yes.
Okay. So today I would like to talk about pregnancy outcomes of patients with uterine fibroids or adenomyosis after high intensity focused ultrasound treatment. So as you know, high intensity focused ultrasound is a non-invasive treatment modality. Here is how, this slide shows how it works. Like this is a transducer. The ultrasound beams were generated from this transducer and focused at a small point. During treatment, the ultrasound beams penetrate the human body and just focus at the tiny point of the tumor. So then during treatment, we can see the graceful changes. And like here, this is liver, here's the pancreatic cancer. And you can see the hypoechoic lesion. Then during treatment, we can see the graceful changes like this. So when the temperature increased over 65 degrees, and we can see the changes like this, then tumor necrosis occurred. So here we can see how did we do this. Like this is we move the focus right here, and you can see the grayscale changes. Then we start solicate again. So we move the focus to this point. Now we can see the changes here. So when the grayscale changes area cover the whole tumor, then we can terminate the treatment. So after treatment, we can use MRI or contrast ultrasound to evaluate the treatment efficacy. So for example, this is a uterine fibroids, and you can see the perfusion before HIFU treatment. Then during treatment or after the treatment done, we use a contrast ultrasound to evaluate the treatment efficacy. We can see there was low perfusion. So MRI also shows the low perfusion in the fibroid. You can see from here, the tumor can be completely ablated and low perfusion. And you can see the surrounding structures, there was low damage. So it means no damage to the uterine, like the muscles. So after treatment, like this multiple uterine fibroids, we can see here, this before, and 1 day after that, even this small one, this tiny one, we can also ablate. And 4 months after that, MRI shows this treated fibroid disappeared, and only a small part of this one still there. And you can see the normal structures of the uterus. So also we can use this to selectively ablate the adenomyotic lesion and minimize the adenomyotic lesion and relieve the symptoms. And you can see selectively ablate the lesion. So after the treatment, also some case, you can see the uterus, for example, like this case, we can see the adenomyotic lesion located in the posterior wall of the uterus. And here, contrast enhanced ultra MRI. So after the treatment, this area, we ablated lesion over there. And 4 months after that, you can see the treated region almost disappeared, only a small part over here. And also you can see the posterior wall of the uterus return to normal thick, almost normal level. So this contrast enhanced MRI shows the thickness of the posterior wall of the uterus is similar to the anterior wall of the uterus. It means we can use this technique to precisely ablate the lesion and give the chance, offer the chance to the patients to get the uterus return to normal. So about the pregnancy after HIFU treatment, we already published some papers. And I don't know exactly how many patients, the numbers all over the world, probably thousands, something like that. But in my center, I just got the number yesterday, we already have 293 patients with uterine fibroids delivered babies after HIFU treatment. And also we have 31 patients with adenomyosis after HIFU treatment delivered the babies. So all the cases, we didn't have any complications during the pregnancy or during delivery. So here is these cases from my center. Actually, I didn't put the new number here. There's a 241 from my center. You can see these patients who want to conceive when they came to our center for HIFU treatment, and the average age was 33 years old. And here is the BMI, and also you can see we have the intramural fibroids and subserosal fibroids, and also submucosal fibroids. Here are the different type of the fibroids, and also different locations. Like here, and the size, the leading number of the size was almost around 6 centimeters in diameter. And the volume of the fibroids is 47 centimeters cubic. So this is a table shows the changes the volume changes of the uterus and uterine fibroids of these patients. And here, this before HIFU treatment, the volume of the uterus, this is volume of the fibroids. And 1 month, you can see the numbers. And here, 6 months after that, we can see the shrinkage rate is around 17% of the uterus. And here is the shrinkage of the uterine fibroids is around 44% of the fibroid shrinkage rate. So this table is very important. And because at that time, we told the patients to try to don't get pregnant before 6 months after HIFU treatment. But you can see from these patients, it's 152 patients already delivered the babies. This all the numbers. And 1 month after HIFU, 8 of them get pregnant. For these patients, because they didn't listen to us, because before HIFU treatment, they said never get pregnant. So also we had 17 patients get pregnant at 1 and 3 months after HIFU. And here 27 cases get pregnant between 6 and 6 months after HIFU treatment. Around 100 patients get pregnant after six months after HIFU treatment. And you can say these patients with the solitary fibroids and also some had the multiple fibroids and also different type fibroids size. We compared, you can see we had some patients had the fibroids smaller than 4 centimeters in diameter, and also we had more patients had a fibroids larger than 4 centimeters. And here, I just want to show you how, like you may ask, why this patient can get saved within 6 months after that and didn't have problem. Here, I just want to show you a case. Like this patient had multiple uterine fibroids. You can see clearly this one was not so large, but she had many, and also some smaller ones. And you can see this before. If we perform mammectomy, probably we will suggest her to get pregnant 2 years after mammectomy. So for this case, she didn't get pregnant before. So after HIFU treatment, accidentally, she got pregnant 1 month after HIFU. So this is the MRI. We got 1 day after HIFU treatment. You can see all these fibroids was completely ablated. There was low perfusion. You can compare with this image before, and also even a smaller one. So we ablated. The most important, we can see that from MRI, we can see there was low damage to the smooth muscles of the uterus. You can see the perfusion was normal. So that's why probably we don't need to worry about that. So that's why she get pregnant 1 month after that and deliver babies at terms. So also you may worry about if the HIFU treatment will damage the endometrium. From this image, you can see clearly, here is the endometrium. And this is normal smooth muscle of the uterus. And you can see here, there is low damage to the endometrium. So we can precisely isolate the fibroids without damage to the normal structures. So also, here is another case. I just, just somebody asked a question about how to avoid to damage the endometrium. For example, like this case, this patient had like say type 2 in uterine fibroids. You can see here is the endometrium, and this is the fibroids. The size was 5.8 centimeters in diameter. So you can see here also endometrium was very close to the endometrium. So for this case, we treated with HIFU, and 1 day after HIFU treatment, the MRI showed the fibroids was completely ablated. Here is the endometrium. So the margin between the endometrium and the uterine fibroids was 8 millimeters. So 0.8 centimeters. Here, there was low damage. So for this case, 3 months after that, she went to have the IVF and already successfully delivered a baby. So this about the uterine fibroids. Here, I just want to show you the results of the patients with adenomyosis treated with a HIFU. So this from Chongqing Haifu Hospital from April 2011 to June 2021. So 31 patients with adenomyosis already delivered babies after HIFU. Here is about the baseline characteristics of these patients. You can see here about the age and also the cause of the disease, like the average is like 7 years from the beginning to the treatment time. And also this is about the location. And 4 patients had the adenomyotic lesion at the anterior wall of the uterus, and 12 of them had the lesion located at the posterior wall of the uterus. The others had the diffusion. And here is about the volume. This patient and painful menstruation, 19 cases, and heavy menstruation, 3 of them had. So this is about the treatment time. So the treatment time is around 1 hour and 50 minutes. And here is about the solidification time. So this is the energy we used, the NPV ratio for the adenomyosis was large because it's different from the uterine fibroids. For this kind of for adenomyosis, we have to protect because there was low margin. Then we have to leave enough distance to avoid like the damage to the endometrium, also like the subsorum. No damage to this area. So the lung perfused volume ratio should be not large. I think for our case, like this 31 cases, the lung perfused volume just around like the 40% like this. So here is about the range. So the symptom improvement after HIFU treatment, here is before the pain score is around 7 points, and 3 months after that, significantly decreased. And also menstruation, like reduced by 50%, significant difference was observed. Here is about the conceived, like 27 cases conceived laterally, and 4 patients went to have IVF for the adenomyosis patient. And delivery, 24 cases had a C-section, and 3 cases delivered vaginal delivery. So also show you some cases like this case, and this patient, she was 26 years old, presented with dysmenorrhea for 10 years, and also with aggravated symptoms for 1 year. Dysmenorrhea starts 1 to 2 days before the period until 1 to 7 days after the period. So the most severe pain lasting 1 to 2 days, and she was unable to get out of the bed to work. So she married for 3 years with her pregnancy. And they tried different way to help this patient, but didn't work. So when they had the machine, like the JC200, then we treated this case, like here, with the lung perfused volume, just 51%. So after treatment, the patient get conceived 2 months after that, even though she had an induced abortion, but 4 months later, she conceived again and delivered the babies. And here's another case, this patient, and you can, from the history, we can see, and also from the MRI, you can see the lesion, adenomyotic lesion, located at the posterior wall of the uterus. And we just ablated part of this, like 51% of the volume. Luckily, she conceived and later and delivered a baby at terms, even though, of course, it's a C-section for this case. So, I mean, from our results, Haifu is really helps this patient for those, I mean, like they didn't get pregnant before, and it helps. So I think we can do a lot of research to confirm this kind of findings. And also another thing I want to emphasize about that. So we didn't have any complications for this patient during the pregnancy, also during the deliveries. Thank you very much.
Thank you, Professor Lian Zhang. Are there any questions? I think many of the questions Professor Aili Zhang has replied.
Yeah.
Let me see. Yeah, the one question is: do we need to deliver a patient by cesarean section after a Haifu?
And yes, that's a good question, because from in China, actually the C-section rate was very high. So from our patients, it seems the C-section rate was high, but actually it was not really lead. So recently, the doctors from Spain, they published their results. So like 64% of the patients delivery laterally, like the vaginal delivery. So it's a really lead C-section, because like we said, we can precisely ablate the lesion and to protect the normal smooth muscle of the uterus.
Another very good question is, how about uterine rupture during pregnancy in post-Haifu adenomyosis patients? Any experience?
So this is very important. That's why, so to avoid this kind of incidents, I mean, this kind of complication. So the most important is about the ablate, the range. So that's very important to avoid this kind of things. So that's why I said we don't need ablate. If the patient don't want to get pregnancy in the future, we can ablate large size of the adenomyotic lesion. But for those want to get pregnancy, 50% is enough. Then we can combine with other treatment. So to avoid this kind of thing. So in my center, we didn't have this kind of patients. I mean, get the uterine rupture during pregnancy. We don't have. And also in China, in other centers, I didn't hear about this either.
Well, another good question is, what is the best time to tell a patient to get pregnant post-Haifu for fibroids and adenomyosis?
So yeah, before we just always suggest them to wait for 6 months, because after 6 months, the uterine fibroids, the shrinkage rate is like 50%. So 6 months will be good for them. But so right now, we found like many patients get pregnant even 3 months after that, even 1 month after that, didn't have any problem. So, I mean, depends on the size and on the numbers of the fibroids. So generally, 3 months after Haifu should be okay.
Okay. I think the big advantage is you don't have an incision on the uterus, so you don't worry about uterine rupture and things like that in Haifu compared to myomectomy. Another question is Haifu increases preterm birth?
So far, yeah, that's also a good question. So based on my experience, our results, so after HIFU treatment, will decrease the preterm birth. So probably like Dr. Silva already gave a very wonderful presentation, already showed us that's why. So that's why, based on my experience, same thing.
Yeah.
Or decrease a preterm birth.
If anything, it's going to decrease preterm births. Yeah. Is HIFU, will HIFU increase implantation failure or early miscarriage?
I think also, it's the same like the previous question. So also, we're decreasing miscarriage. I think I forgot to put one table to compare before and after HIFU, like the miscarriage rate, significant decreased in my center.
Okay, thank you, Professor Lian Zhang, for this wonderful lecture. It's always nice to listen to you and motivate me to do more HIFU.
Thank you very much. And you already did a very good job. Thank you very much.